Welcome to Riverside Talk. My name is Denise Mananas. I'm the Associate Vice President for External Affairs at St. John's Riverside Hospital. Today we are discussing what young athletes should know about head injuries and concussions. We will be talking to Dr. Brijesh Malkani about this topic, I will introduce in a moment. But first, I would like to acknowledge our team, Nancy Anabi, Candace Cousins-Hopkins, Olivia Hunter, and Jason Latore, who produce all of the programs that we have at St. John's and who do an amazing job every time. And I'd also like to thank and acknowledge our original partners in our community education efforts. That's the Yonkers Neighborhood Naturally Occurring Retirement Community and the Yonkers Public Library. But we also have some really wonderful new partners, and I'd like to acknowledge them as well. The Ashling Irish Community and Cultural Center, the Department of Veterans Services in the city of Yonkers, the Ardsley Senior Center, Bronxville Community Center, the city of Yonkers, Community Baptist Church, Greenberg Parks and Recreation, the Hastings Community Center, Irvington Community Center, Westchester Jewish Community Services, and Yonkers Pathways to Success. So thank you to all of our partners. And now I would like to introduce Dr. Malkani. Dr. Malkani is a dual board certified sleep neurologist and serves as the medical director for the Mount Sinai Doctors in Westchester. He is a firmly rooted New Yorker, having completed both medical school and neurology residency at NYU School of Medicine and NYU Medical Center. Thereafter, he completed a prestigious fellowship in sleep medicine at the University of Pennsylvania. Dr. Malkani offers expertise in a wide array of neurologic conditions, from common back pain and sleep disorders to complicated migraines and dementia. And so today, Dr. Malkani, welcome to our program. Thank you for being with us.
Thank you for having me. It's a pleasure.
Today is an interesting topic for me because I have recently had a concussion, so I'm very interested to get your knowledge and talk about this, because I don't think people really realize how bad concussions can be. So before we get into any stuff, why don't we start at the beginning? What is an actual concussion, and how is that different from what doctors call a traumatic brain injury?
It's a very good question. I am happy that this topic is getting more awareness and understanding. I think some of that may be coming from the NFL and from professional sports and athletes. The definition of concussion is actually not very different from a traumatic brain injury, which sounds really bad.
Yeah.
And some concussions are worse than others, but a acute, mild traumatic brain injury, or so a recent head injury that's considered mild, that's what we consider to be a concussion.
Right.
Certainly there's other associated symptoms with that, which we can talk about, but they are quite synonymous.
Okay, so not really a difference. So a concussion is an injury to the head, and what are the things that characterize, what are the symptoms, what do you see when you diagnose a concussion?
Right, so concussion is a head injury with or without loss of consciousness. So you don't have to necessarily black out in order for it to be considered a concussion. Things you should look for that sometimes happen right away or afterward can be a headache, can be dizziness, brain fog, which we talk a lot about now. Sometimes it can be bad and people have seizures or vomiting. And in those situations, we may need to pursue further evaluations and things more formally than you would do on the sideline. So it can vary quite a bit, but there's a variety of symptoms that may occur.
Okay. So that's very interesting because, from my own experience, which was 3 weeks ago, I've had a fall. I landed on my head. And I felt like, okay, I'm fine. But, it's been a process, and things that I didn't feel initially, I felt afterwards. So all kinds of things like that can be normal.
Yeah, I hope you're feeling better.
Yeah, I am feeling better.
I'm glad you're here.
They wouldn't let me do this if I weren't feeling better.
Exactly. So. Right? We wouldn't be here right now if you were still suffering. And I'm glad that it subsided quicker than later. So it is quite normal to have these sorts of symptoms afterward.
Okay.
And concussions, unfortunately, they do happen more often than we want to recognize.
So that's very interesting, and I think that goes along with the reference you made to what's going on in the media. There's been a lot of press about students and kids in summer camp and in football programs and soccer programs, mostly about the young boys, young men who are playing these sports because they're so physical. But even now, women, girls in soccer, we're seeing some things, and there have been reported head injuries. How do people recognize what they're looking at? If somebody's playing something and they got knocked in the head, but it doesn't seem like it's much of anything, I guess what I want to know is how, if there are adults and counselors and other people around, what are they looking at? What are they looking for?
So I think things like this that St. John's does is extremely helpful to the population to create awareness, because that's what you need. You won't be able to do anything about it if you're not aware of it.
Right.
So identification is first. Now, what do you identify? So if someone does have a head injury, it does make a difference if they did lose consciousness or not. Are there symptoms, headaches, and confusion, or are they unsteady and wobbly and clearly should not be continuing to play?
Okay.
Removing athletes from play is something that is recommended and should be done immediately if there is evidence of a head injury and a concussion.
All right.
Whether they go back into play is a different question, and most times rest is best. But we also need to be mindful that these symptoms can continue, can persist, and we need to be cautious about second impact syndrome, where someone can have a second head injury or repeat head injury where it's too soon, and that further exponentially worsens the extent of the first one.
So CTE you referenced, can you just tell me what that stands for and what is that?
Sure. It's a fancy word, chronic traumatic encephalopathy. It just means repeated head injuries to the brain that have left some scarring.
Right.
And when that occurs, we typically only find that on autopsy after, unfortunately, someone's passed away, and we have to do pathologic sort of slicing of the brain to see that. And we see that damage there. There was a famous wrestler that unfortunately they found CTE and had some neuropsychiatric symptoms.
Right.
And tragically, it seems murdered his family. And so it can be quite serious. And that's sort of an outlier, an extreme case. But it just goes to show you how seriously we're now taking this.
So you used a term scarring, which I never really think the brain is something that can be scarred. But I guess repeated hits to the head and repeated concussions do scar the brain. And it did have an impact on that wrestler. And I know it's had impact on other football players. It's been in the news a lot. But to get there, I mean, that's a professional wrestler, professional football player. They've had a lifetime of being hit. One or two concussions in your life, they're not going to necessarily scar your brain, and I'm checking for myself. They're not going to scar your brain and cause these kinds of issues. Is that a fair statement?
I don't want to create undue anxiety.
Right.
So if you accidentally have a head injury, it doesn't mean you're going to have lifelong ramifications of that. However, you know, it really depends. Some people can have one head injury, and if there's a bleed that's associated with that.
Okay.
So when we have someone that's elderly, their veins are a little more susceptible to rupture. When we have people on blood thinners, that's a concern. Those sorts of situations, we may want to get a scan of the head and make sure.
Well, that brings me to the other point when we were talking about the kids and being hit and what they were experiencing when they come home and the symptoms. If you are in doubt, regardless of the age of the person who's been hit, how do you diagnose for real? You obviously, they're the symptoms. We've talked about those. But you go to the hospital because now somebody's vomited, somebody's got, had a seizure, or somebody's just really not right. You go to the hospital. What do you do? What kind of tests do you run?
So in certain situations, they would probably get a scan of the head, a CAT scan.
Right.
And it depends. Just because you have some dizziness or a headache doesn't necessarily require getting a CT head. And I would trust the ED providers that are in the hospital. They have a good index of suspicion. In certain cases, you would check those, but it doesn't quite rule in a concussion.
So you're looking to rule out.
Yeah,
you're looking to rule out. You're looking to get rid of no bleeds, none of that stuff. What else do you look to rule out other than the bleeding?
That's the majority of it, because even with MRI, you may pick up other things, other findings, like, God forbid, brain tumors or strokes, and hopefully that's not the case. But the vast majority of the time in the acute setting, in that immediate time frame,
Right.
you're looking to get a scan of the head just to make sure that there's no significant bleed that's happened internally.
So even if there's no bleed, doesn't mean that you don't have a concussion. You just don't have a bleed.
Correct.
So how do you come to the conclusion that somebody's had a concussion? Because what is it? It's a bruise, right? You've bruised your brain.
It's a head injury with associated symptoms. So if you hit your head and then subsequently have either headaches, dizziness, brain fog, all the things we've talked about,
Right.
you had a concussion.
Oh, good. Well,
Yeah.
I've had that. Okay.
Yeah. As have I.
Yeah. Oh, okay. We'll talk
Yeah.
about that
Yeah.
later. We'll compare stories. Okay. So you're talking about a CAT scan of the head, and those are short term. And most people, most kids, most adults who have had an injury, they do resolve. Those symptoms will resolve. It's what is it? It's time. Is there medication? What did people do to get better?
Great question. So yes, rest is best. However, we also want to try to go back to activity sooner rather than later.
Oh,
A day, 2 days. We find that actually restarting activity at a lower level,
right.
gradually increasing it. So if you're an athlete, maybe just doing aerobic exercise. If it's academics, then perhaps going a half day to school or going 4 days in the week. But making adjustments to gradually increase your threshold, because we do want to get back to our day-to-day functioning.
Right.
That takes time, and there is rest involved. So it's finding that right balance between the two.
So that takes time. If people are like me, I need to hurry up because I got stuff to do. So I have no time for this. With that said, being kind of funny about it, what is a realistic time frame for getting better?
So approximately 4 weeks,
Oh.
we would say we would want to see improvement. The prognosis for concussions is good. So
Okay.
despite all of this conversation, about 90% of athletes that see a provider within 4 weeks will improve.
Right.
Sometimes there's lingering symptoms, and I've had patients that are going months, and sometimes there's someone I can think of who over a year, unfortunately, did have still some lingering symptoms.
Interesting.
So that is an outlier, but for the vast majority, do recover within a month. To your question about treating it, you're really treating symptomatically the symptoms. So like a headache, you'll give some Tylenol. Some dizziness or nausea, you can give some medication for that.
Not Advil or
So potentially Advil you would avoid because of the concern for bleed
bleeding.
risk,
Okay.
right? Tylenol would be
Tylenol.
better, especially initially, and if you don't know and if you hadn't had a scan. There's Zofran, for example, for nausea, but obviously consult your healthcare provider
Right.
before doing that necessarily. It is a prescription medication. Nothing's going to speed it up. You're treating the symptoms to try to make it more manageable. It's
Okay.
not going to speed recovery.
Okay.
But if you are more comfortable, you're likely to relax more,
Right.
likely to heal better.
Oh boy. So it's very interesting. You said you had an outlier, somebody who went a whole year with symptoms. That's not the norm. What other long-term symptoms would people be looking for? Like, what was that person experiencing?
I would say headaches tend to be the most common. Sometimes people say they'll get some dizziness from time to time.
That they never experienced prior to the injury.
Some do and some don't.
Interesting.
So some people had dizziness or headaches before and now it's worse.
Oh.
Or they didn't have it
Right.
and now it's started.
Right.
And so we try to manage it symptomatically and try to help them recover.
All right, so let's go back and talk about our athletes. Let's talk about kids. They've had an injury, they've had a concussion. you were talking 4 weeks before they could really play again.
I would say 4 weeks until most of them are normal. I wouldn't say it's necessarily 4 weeks for them to play.
Okay.
Getting back on the field sort of depends on their course, and once they're essentially symptom-free, which can be in a week or it could be in a few days.
Okay.
Sometimes it doesn't take
So it
as
is
long.
very personal.
It's an individual clinical case,
All right.
case-by-case basis.
So I guess the message for the parents, because that's little kids, and you have the high school kids who are much more intense about their team and winning and the season and getting back, but really safety first, because to re-injure an injury is where the trouble begins.
Correct.
Okay.
Brain safety is number one, right?
Yeah.
We can't ignore that, and we can't overlook that. And it doesn't mean they're not going to still have a successful season or get back on the field and play well. And I understand there's playoffs and there's senior year and things like that. But I think it's important to understand the risks that come with it.
You know, one of the things I noticed after falling on my head was that screens bothered me. Phone screens, computer screens, the TV screen, the light. Is that a thing?
Oh, yeah.
Okay, so talk to me about that.
Light sensitivity is quite common.
Okay.
And we're in a society now where everything's a screen, right?
Everything is a screen.
Your pad, your phone,
Yeah.
your TV, your computer. So clearly we have far more exposure to blue light than we did ever before. So it's important to try to either dim the screen or try to stay away from it, as a matter of fact. If you,
Well, that's a little tough.
I know. We have to make adjustments.
I know, but that's a little tough. I'm not sure. Is that even possible?
It can be done. I think we can minimize and maybe set time frames, parameters, not be on it 3 hours straight. Maybe if we have to do 3 hours in a day, 1 in the morning, 1 in the afternoon, 1 in the evening. There are ways to change to do that, especially because if you think about 10 or 20 years ago, right? Pre-Apple,
Right.
someone wanted to reach you, they called, they left a voicemail on the answering machine, you were out and about,
Nobody cared.
You weren't getting blitzed with emails and text messages and phone calls. So society has changed.
Well, it surely has.
Yeah.
But
It's manageable. We lived before. We did
Yeah.
fine for 100 or 200 and something years. So I think it's certainly possible for short term to be able to make those adjustments.
Okay. So that's good for parents to know, for their kids, but also for themselves. The other part of this, you know, when we talk about soccer and we talk about football and we talk about teams, there's a tendency to think it's boys, it's young men. But girls are very active now, very much into sports. Soccer's huge for young girls and teenage girls. When you're talking about concussions, are you seeing more men than women, more boys than girls? Are you seeing what is there a gender difference in what we're seeing nationally? I mean, do you know?
I don't know if there's any specific studies that speak to that. I would say in my clinic, I probably see more men than women. But I think sometimes on the women's side, it may be underappreciated or it's not getting as much attention and therefore it's overlooked.
Yeah.
But certainly you're right. Soccer and women's in particular are prone and disposition to it. So it's not that because you're a girl you can't get that same head injury and concussion. And I think it's just, again, awareness,
Right.
and people to keep an eye out and survey and monitor.
Right. Do you think there's a difference in the severity of a concussion based on gender, based on anatomy?
I don't think so.
Okay.
I don't know that, and I don't know that there's studies speaking to that. Obviously, we're each different in how we respond and what happens. And perhaps as we go down the line, there'll be more data to say, well, women recover faster or slower.
Right.
But I think men sometimes can end up in more violent type sports. I had a Brazilian jiu-jitsu fighter who would keep getting head injuries, and I had to have the conversation about retirement. And no one wants to have that conversation. And it was almost the more violent the sport, the less likely someone's to walk away from it. That being said, yeah.
Okay.
Oh, they're passionate, right?
Yeah,
There's a
I guess.
certain love there for it. But I think it's important to have those conversations. And as I was saying, I think men typically you'll skew more into those, but it's not unusual for women to be MMA fighters and other things like that. So we have to be just as vigilant and be just as careful.
All right. And we sort of touched on this a little bit before, but I kind of want to circle back to it. I know my own attitude is, okay, I need to get on with this. I don't want to pay attention to this. I got to go back to work and I got to do what I need to do. And I know that many athletes and many people who've sustained an injury want to get back out there. And there are coaches and there are parents who encourage that. So what do you say to all of us who are in a big old rush to get back in the game?
I would say you have to slow yourself down. You have to listen to your body and what your body is telling you. And if it's saying, I'm not right, then you have to.
But if you're a 15-year-old and your coach and your parents and your teammates are going, come on, we need you, how do you withstand that?
Well, I think it's incumbent on the coaches and the parents to understand that this can be hazardous. I think for a 15-year-old, they're going to feel that potentially that pressure, but they also have to be able to be honest with what they're feeling. And you would hope that medical professionals and medical folks
really
that are
prevail.
there, yeah, they would have their say in this, and it's not necessarily up to fans. It's more up to people that have a little bit more knowledge.
But then to go back to sustaining another, even if you're not injured in certain games, and you're playing too quickly with a concussion, the cumulative effect of these we started talking about a little earlier, and we went to the
CTE.
That's it. We went
right.
to the CTE. But every time you hurt your brain, there can be a cumulative effect. So it doesn't have to be at that extreme. Is there a place where you've caused damage cumulatively over time, and then you just have a chronic situation, a chronic pain, chronic symptoms? Because I really want to get across the idea that people have to pay attention to this. I sort of wish when I got hurt that I had, paid more attention to what I should have done and not like, okay, I'm fine, I need to go back to work, I need to do things, and just took a little more time. I'm a little surprised, I guess, in how long the symptoms linger. And so when you have injury on injury and an injury, do you have a point where, not getting to that other really bad issue, but do you have a place where all of a sudden you have chronic symptoms?
So it's possible. I think where we see more risk is in if you have an injury and within 6 weeks you have another injury.
Yeah.
That can have this sort of a little more of an additive effect. If you were, 5 years old and you bumped your head on the playground, another one when you were 30.
Yeah, it's not
another
not
one
the
when you're
same.
60. I think you'll be fine. And each injury is individual, and God forbid there's a brain bleed on one of the future ones. Obviously that changes things. But by and large, I think if you're careful and vigilant, to your point, it's on the sports field that sometimes adrenaline kicks in, and sometimes in the heat of competition, people want to perform. So I think that's where more efforts are being dedicated, and
Right.
rightfully so.
So let's go now to the extreme, back to the CTE, which is the neurodegenerative disease that it actually can cause some of the things you reference. Some of these people have violent issues, but it also causes dementia.
There can be elements of dementia, neuropsychiatric elements.
Okay.
I think that again is more of like the extreme population, professional fighters and professional athletes. Doesn't mean others can't have it, but I think then you're looking at people that have had many head injuries over short periods of time.
Right.
And so I don't want anyone to think just because I hit my head, I may get dementia.
Right.
I think it's more so when it's an additive effect over many years, that's when you're running into problems. And that's when that whole conversation about retirement comes in. I think for the one-off situation, it's sort of, you take it very seriously and you start making changes. You start thinking about things a little bit more and you think about this issue a little bit differently.
Right.
But that's where we learn and that's how we advance and that's how we sort of protect ourselves for the future.
Okay, so to wrap it up here, I think that yes, there are scenarios where people who do have repetitive injury over time based on what they're doing could have issues, maybe, that could lead into something really not great. But for most people, for most athletes, the prognosis is you gotta rest. Rest is best, and you have to take care of the symptoms and really be patient with them. And then go back to doing your stuff, whatever it is. Going back to football, go back to soccer, go back to work.
Right. And I think it's a gradual approach, right?
Okay.
And so resting at first, maybe it's a few days, maybe it's a little longer. But when you do start to want to restart your functionality, right? Like we talked about, whether it's academics or athletics,
Right.
there has to be a slow and gradual increase so that you ease your way in. And then hopefully it's sort of, you get back to yourself and can live your day-to-day life.
All right. Well, I thank you so much for joining me today to talk about concussions. I know it's a hot topic out there, and we really appreciate your time. And I'd also like to thank our audience today for being with us. Join us again for our next Riverside Talk.